Crest Trial is a multi-center trial in the United States and Canada that was funded by the NIH to determine the efficacy of carotid stenting relative to carotid endarterectomy. In fact, the Crest Trial is an acronym for Carotid Revascularization Endarterectomy versus Stenting Trial. So that's where the Crest part comes in. And the intent of the study was, as I say, to compare the two procedures to help in determining in which patients one procedure might be better than the other and whether or not carotid stenting was comparable to carotid endarterectomy. This was a controlled, randomized clinical trial across multiple centers with many individuals involved to provide the best possible information in determining which of these procedures might be better in certain circumstances for patients with carotid disease. And frankly, there has been great skepticism early on about carotid stenting, and I think this trial needed to be done in order to determine whether carotid stenting had an efficacy and an effectiveness that was comparable to carotid surgery or endarterectomy. The basic problem with carotid artery occlusive disease is the development of atherosclerotic plaque in the carotid artery, which is the main channel of blood supply to the brain. There's a carotid artery on each side, and if plaque forms in either of those carotid arteries and the degree of narrowing becomes severe, then a person is at significantly increased risk of stroke occurrence. And it is the prevention of stroke occurrence that is the focus of carotid intervention. Carotid endarterectomy is a surgical procedure that involves an incision on the side of the neck, usually done under a general anesthetic, but it can be done under local. In contrast, carotid stenting is done with a local anesthesia in the groin. There is a puncture of the artery in the groin through the skin, and a catheter is led up to the carotid artery where the stent is placed. And there, of course, is great appeal to a procedure like stenting, which is less invasive in many ways, but on the other hand, carotid endarterectomy is also done with a very brief hospitalization. Usually it's only a one-night stay in the hospital, which is the same as for carotid stenting. And the results of carotid endarterectomy over the years have been superb. The Crest Trial has extended over a period of 9 years, during which time in 117 centers across the United States and Canada, a total of just over 2,500 patients have been recruited for participation. And each patient is randomized between having carotid endarterectomy on the one hand and carotid stenting on the other, with the view of comparing the two treatment methods. These are in patients who have severe carotid artery blockage and are thereby at significant risk of stroke occurrence without either of these two interventions being done. We feel privileged and honored at the Baptist Hospital that our institution was chosen as the only site in the state of Mississippi for the conduct of the trial. There are, as I said, a total of 117 centers around the country, and each of these centers, including the Baptist, were carefully evaluated, and individuals participating in the trial were closely vetted to assure going into the trial that the best methods of treatment could be offered, whether it be carotid surgery with endarterectomy or carotid stenting. And the results of the trial overall were that the two procedures are comparable to one another. The results of combining those three endpoints, that is heart attack, stroke, and death, was about 7% in both the carotid endarterectomy and the carotid stenting arm of the trial. These results were, on surface, you would interpret them to indicate that the two procedures are comparable, but like any other complex study involving so many different variables, if you drill down beyond those primary endpoints, you see there are some differences. And I think it's first appropriate to say that carotid stenting and surgery have proven in this trial to both be very effective procedures. In fact, there are other studies that have recently had results released which have shown one or the other to be better. I think my personal view of the consensus of studies that have come out over the past several years is that carotid endarterectomy remains the frontline treatment for patients with carotid artery disease. But there definitely is a place for carotid stenting. And I think that's wherein becomes the great importance of individualizing every patient who has carotid disease to determine which of the two procedures is better. So you can look at this one of several different ways. You could certainly say that a combination of the results indicated that of the three endpoints indicated that the two procedures are comparable. But on the other hand, the primary focus of this surgery is stroke prevention, and that's the primary focus of both stenting and endarterectomy. And endarterectomy proved to be more effective in preventing stroke by a factor of about twofold than did the stenting. And it was only when the myocardial infarction endpoint was added to the results of the study that the two procedures became comparable in their outcome. I think at this point in time, carotid endarterectomy is the frontline procedure. But there are certain circumstances in which carotid stenting is definitely a better procedure. For example, local factors having to do with patients who have had previous carotid surgery. Local factors in the neck related to neck irradiation are two examples of where carotid stenting definitely has a place. One important point about the Crest trial is that the study was conducted in hospitals around this country and in Canada that had a proven record of excellence in taking care of patients with carotid artery disease, not only demonstrating efficacy of carotid endarterectomy, but also with carotid stenting. And I think it's important to realize that the results of Crest are in settings that have demonstrated that excellence. And that point carries over for the future, that people who are having carotid artery disease treated would best have that treated in a setting that offers expertise in both carotid endarterectomy and carotid stenting, and that there can be appropriate application of knowledge about the two procedures and applying them to patient situations so that each individual patient is treated in the best possible way, whether it be with surgery and endarterectomy or whether it be with stenting.